Hello, beautiful humans. Welcome back to your favorite you. I am so glad that you're here because, oh my goodness, do I have a treat for you and for me. Okay, I'm going to start with a question, and I want my listeners to really think about this. How many years of formal education did you have? Grade school, high school, college, maybe graduate school, professional school. Most of my listeners have gone to many, many years. So I want you to add it up. And then I want you to think about in all of those years, across all of those courses, was the clitoris ever mentioned? Was it actually named, discussed, explained? For most of us, the answer is no. And today's guest is here to talk about exactly why that matters and what we're going to do about it. Dr. Nina Deep is an award winning physician, a nationwide speaker, a fellow person from Columbus, which I love. She has built an entire mission around one radical idea that women deserve to understand and know their own bodies. She's a board certified internal medicine doctor. She's been running her boutique medical spa, Nina Deep MD Aesthetics, here in Columbus for over 20 years. And she's the founder of a speaking platform with possibly the best name I have ever heard in my life. It's called The Clitoris. Now, how did she get here? A TV station censored her commercial about vaginal rejuvenation. She pointed out to that station that they happily ran commercials about erectile dysfunction treatment without batting an eye, and they didn't budge. So she decided, fine, I'm going to talk about this everywhere to everyone for the rest of my career. And this is the kind of energy I want in my orbit. And so I'm so excited to have you here today, Nina. Welcome to your favorite you, Dr. Deep. I'm so happy you're
Thank
here.
you. Thank you so much. What a nice introduction. I love
Yeah.
that. And I am so thrilled to be here.
Yeah. Amazing.
Yeah.
So go
Yeah,
ahead.
everything you said was exactly right. And I think if people really think back to the fact that if you're a woman and you realize that you have never been taught the anatomy of your body, it's rather shocking. And perhaps it's shocking to everybody, but even more so if you're a physician and you
Yes.
haven't been taught the anatomy of the human body, which for me was such a moment of disillusionment when I realized the extent of lack of knowledge that I had had, even as a physician. And then,
Yes.
to understand that when you describe me having vaginal rejuvenation as a procedure, I had this lovely commercial that I was so proud of creating because it was a little bit humorous and it really allowed women to seek out help for complaints or problems that they might have. And it's really hard for women to discuss these things, urine leakage, vaginal dryness, wanting to improve their sexual function. Those things are things that generally are topics that women just will accept and not
Mhm.
seek help for. So it was quite a shock when that commercial was censored.
Yeah. Yeah. Fuck censoring any of us. Like, I'm just like, fuck it all.
I
You
know.
know?
I totally agree. And it was such a discrepancy of such a disparity between what's fair for men and what's fair for women. And to be honest, I had started that commercial in 2018. And just to give you a brief overview, the words of the commercial are just, 50% of women struggle with urine leakage, vaginal dryness. Oh no, 50% of women struggle with urine leakage and many more struggle with vaginal dryness. If you're one of them, there's this great procedure called the VV treatment, blah, 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 blah. At the end, I say side effects include increased orgasm and enhanced sexual sensation, which was,
Who doesn't want
and
that?
who doesn't want that? And it
Right.
was such a great way. Our patients would call the office. They wouldn't know, what it was called, but they would be giggling and they would say they wanted to have that procedure for urine
Mhm.
leakage. They
Mhm.
actually would never say vaginal dryness or that they wanted to have an improvement in their sexual sensation. But when they came to see me, often
The
that was the
truth comes
presenting
out.
complaint. Yeah, but women in general are just embarrassed by those topics. So
Right.
humor was a great way to get them to initiate, to seek treatment.
Yeah.
And
Yeah.
we
Yeah.
just had
Yeah.
so many fantastic years of treating patients, and I was running that actual commercial. And when I switched advertising stations was when it was censored. And that
Mm,
was what was so shocking to me too.
right. Well, and it's so interesting, right? Because let's run all these commercials for erectile dysfunction and
That's
have
right.
these men being able to have sex for days
That's right.
and, but
Let's leave the women behind. And also it's just been so normalized for men that there are abbreviations. There's ED. And
right.
there's many different companies. And even grade school kids, I bet, know the phrase, if your erection is lasting for more than 4 hours.
Seatbelt
Right?
of
We all
Pacific.
know it.
Yes. Yeah, yeah,
It's just
yeah.
so normalized that when the TV station wanted me to change the commercial, um, I actually understood why I got it. It was so
Mm-hmm.
shocking for them. They just could not get around the idea that women were allowed to be sexual beings. We can be sexualized, but we
Right.
can't own our own
Enjoy
sexuality.
it.
Yeah,
Yeah. Oh,
that's
Lord.
right.
Okay. So let's back up a little bit because
Yeah,
I've got
let's
a
back up.
ton of questions for you,
Yeah.
but I don't want to let you get past my favorite question for all of
Oh,
my
yeah.
guests, which
Okay.
is please tell our audience about your favorite you, Dr. D.
Yes, I should have had this fully prepared, but now that you're actually asking my favorite me is continuing to push comfort level and boundaries for things that I truly am passionate about changing the status quo. And I would never have thought that just I started this vaginal rejuvenation device. I wouldn't have thought I would have to be an advocate for women's sexual health out there in the big bad world because I'm
Mm-hmm.
okay to do it in my little corner, but
Mm-hmm.
it was profoundly necessary at this point,
Mm-hmm.
really. I actually was so shocked because my commercial, I'm in a lab coat, and they said it was okay that they could play me in the middle of the night, just like they do the Lion's Den commercials.
Mm.
And I
Oh,
thought, there's nothing wrong with the Lion's Den, but
right.
I'm literally a professional trying to help women, and you're censoring me in a way that is going to inhibit women from seeking care.
Well, and making it seem dirty.
That's right. And they believe it's dirty. That's the problem. They
Yeah.
really do.
Mm. They need to go to
So
therapy.
that's right. That's right.
Oh gosh. Oh my gosh. Oh my gosh. Okay.
So yeah, continuing to live in my truth, I suppose, is my favorite version of
Yeah.
me,
Yeah.
even when it's
Yeah.
uncomfortable.
Right. Especially when it's uncomfortable, because that's when it
Yes.
actually starts to help people.
Right. Because when I first thought about even bringing the vaginal rejuvenation device into my practice, I had
Mm-hmm.
to pause and think about it. Like
Mm-hmm.
I'm giving women Botox and, laser rejuvenation
Resurfacing.
procedure,
Yeah.
right? And all of a sudden I was gonna, even though women's health has always been a focus of mine,
Mm-hmm.
um, I thought, I wonder if my patients are going to want to come to me for this
Mm-hmm.
procedure rather than going to their gynecologist, for example.
Mm-hmm.
But no one is offering it. Like at this
Right.
point that I was doing it, that kind of care, I am actually the right venue for it.
Mm-hmm.
And then when I brought it in and I first wanted to advertise for it, I honestly, even myself, was using the words intimate parts, like
Right.
euphemistic language, I myself, and it felt so wrong. So it took me a minute to get to, I'm allowed to say these
Unlearn
words.
all of that.
Yeah,
Yeah.
yeah. And so that whole learning experience for me has been so transformative, and it has
Mm-hmm.
been just such a gift to be able to be open about it and to be able to lecture about it, and then to have everyone feeling so empowered after learning this information that I hope it does change the way that they talk to their kids and their friends.
Right. 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 Right.
Yeah.
Oh gosh. Yeah. I mean, back in my pediatric days, I
Yes.
mean, I would talk to the kids, young men, young women about all of it. Right.
Yeah.
And, I think that they were so they felt so safe with me because we had built up this relationship over the years and that type of thing. And I didn't shy away from any of it, and they knew that they could talk to me. And it's one of the greatest,
I agree.
prides that I have from my pediatric practice days of just making, sexual health not be
That's
taboo,
right.
even
Creating that safe
for,
space. That's
yeah,
right. Yeah, for boys and girls.
yeah, yeah, because I mean, we're sexual beings from a
Yes.
quite a young age.
Yes.
Um, and I think taking ownership over that, especially as young women, helps us to not be victimized or to know when we are
That's
being
right.
victimized.
Yeah. I know you talk about being a recovering Catholic.
Mm-hmm.
I feel like
Very
I
much
am,
so.
although I was raised Hindu. But
The
I
shade goes across the
that's right.
religious
That's
spectrum.
right.
Yeah.
I always think to myself, I do feel like that. Yeah, I was raised in Dayton to an immigrant family from India, and my parents, I think they came here believing that their daughters were going to adopt a value system that wasn't similar to theirs. So they were
Mm,
going to lose that that they were going to become shameless hussies, is what my mother would say. And it's not, I don't think it's that uncommon that people would
yeah.
think, especially immigrant families, but maybe anybody. Um,
Yeah.
and she very much worried that we would get pregnant, and
Mm-hmm.
it's just a norm. I get it. It's a normal fear that you have. But
Right.
boy, did I internalize all of those ideas that
Mm-hmm.
being being at all interested in sex was a very bad thing
Mm-hmm.
as a girl, that our
Mm-hmm.
sexuality was dangerous. And I was such a good girl,
Mm-hmm. Mm-hmm.
intentionally.
Mm-hmm.
And I'm surprised actually that I was able to go to college, go to med school, get married to my husband, and have such a great sex life with my husband. Like, I actually am surprised by that
Right.
because of all of this internalized shame that I truly did have.
Mm-hmm.
And it really wasn't until 2018 when my patient started to. So I did this vaginal rejuvenation device. I brought it in my
Yeah.
bag, and I had the procedure myself, of course, and I actually didn't have any of the side effects. Like meaning, I didn't not the side effects. I didn't have urine leakage that much. Like
Mm-hmm.
yes, a little bit. If I was gonna
Mm-hmm.
go for a run, I might think, oh, I better not run too far because I have to go back to the house
Mm-hmm.
and take a potty break. But I didn't have vaginal dryness, but I also was like, an increase in my sexual sensation, that would be pretty fantastic.
Mm-hmm.
And so this transformative event happened after I had the procedure,
Mm-hmm.
and it's something I never thought would happen. I didn't expect it, but I went into every intimate encounter with my husband after that with this completely different mindset. I thought that the whole thing was about me, which, maybe we all should go into it that way, but I had never done this. I always
Yeah.
thought like my virginity or my sexuality or these sexual encounters, it was basically these gifts that I was giving to my husband. I just went
So
into this
interesting.
to intimacy with the idea that men want it and women give it.
Yeah, it's a transaction.
It's a transaction. And it never occurred to me that it should be different. I'm not saying it wasn't fun. We had a
Mm-hmm.
good sex life. But when
Right.
I had that procedure,
Mm-hmm.
my mindset shifted. I was paying attention to my body in a way I never had. I communicated more like, "Ooh, that feels good." I was so curious about, "Oh, is this better?" Like, what is
Mm-hmm.
it? What's going on down there? And
Yeah.
just I felt so different in my body that over like the 6 months, because it's 6 weeks to 6 months, your sensation is supposed to be better.
Yeah.
It did get better, of course.
Mm-hmm.
But my whole approach to intimacy with him shifted, meaning I initiated it more often. And
Right.
when we were intimate, I was so much more open and I like lost that shame. I
Mm-hmm.
almost felt like I just didn't have to apologize for being
Mm-hmm.
me and that I was a sexual being. I could embrace it. And then over the 6 months, I think I started to put down all these boundaries in my
Mm-hmm.
personal life. Like, so things
Mm.
in the bedroom changed, but it transitioned and translated to my life.
Right.
And I
So
just,
interesting.
yeah, I was putting down boundaries with family and friends. I like let go of relationships that no longer served me. I became a better boss, a better leader. All of a sudden, my decisions, I felt more confident in them. And really, my whole kind of like confidence shifted. I'm a confident person, but it
Hmm.
shifted in a way that if I felt like something was right, I just listened.
Yeah. So cool. I mean, I am a huge fan of Kelly Casperson. I've had her on the
Yes, I
podcast,
am
and I'm
too.
sure we're both in the Kelly Casperson fan club.
Yes, yes, yes.
And, she says, and I don't know if she's the person to say it, but she's who I quote, our brain is our biggest sexual organ.
Right.
So, if you're taking this new mindset into the bedroom, it makes sense that you would start having different experiences,
I
and then
agree.
that would be able to translate into other areas of your life.
Yeah,
And
and I think as physicians, and I don't know how you felt, but I always felt like my patients needed to be physically, mentally, and spiritually strong. Like those were like the three
mhm,
pillars that I was like,
mhm.
Let's make sure they've got all that going on." But their sexual health history was really just are they at risk for sexually transmitted infection?
Yeah.
Like it wasn't too much about, are you embracing your sexuality? Is that a core
Mm,
pillar of who you are?
mhm.
But after I had this procedure and I let go of that shame, I realized how much shame can disempower you. Even
Yeah.
if it's something you don't realize you're carrying, by releasing that, I
Mhm.
felt so much more empowered. I felt like I was the woman I should have always been.
Yeah, so interesting. And
Hmm.
what I'm hearing you say, and you can correct me if I'm wrong,
Yeah.
is that your parents worrying about you guys becoming hussies made it so that you were a good girl. So you
That's right.
didn't experiment in that type of thing when you were younger. And who knows, you don't have to give me the whole thing. And you still carried the shame
Yeah,
into this relationship where I'm sure your parents, as soon after you got married, were like, when are the babies coming? Like they
exactly. All of
expect you
that.
to flip the switch where,
That's right.
I'm not a sexual being at all, to all of a
Right.
sudden it's
That's
my job
exactly
to
right.
make babies.
That's right.
But I'm here to tell you that even those of us who were sexually active when we were younger, and like I'm talking about everything except, you know, uh, penis and vagina sex where you
Right.
could get pregnant, because
Right,
as a
right, right.
Catholic,
Yes.
schoolgirl, I certainly did not want that to happen. But like the shame of those experiences, and even sometimes the shame of, oh my
What
God,
led
like
up to it? Like all of the,
that, and like, oh, I don't want to name names, but poor so and so, like I was such a tease, like, I mean, even that shame of like,
right.
you know, he never did get to insert his penis into my
That's right.
vagina.
Right.
And
That's
the
right.
shame of that still as a
It's
50
like,
fucking 3-year-old. Like,
exactly. Exactly. I
yeah.
know. I know. And I'm not saying we didn't have premarital sex. I'm just saying that it was very, it was limited, everything. And
Yeah.
the shame I carried, even of that, that
Yeah.
I'm having this before we're married, which
Mm,
now, doesn't make any
yeah.
sense to me.
Well, yeah, now I'm like, oh, I wish I had had more sexual
Exactly.
partners. I
That's
forgot. Oh,
right.
I
That's
was
right.
talking to my Indian friend, one of my Indian friends, not Bonnie. And she was saying how she didn't want her daughter to be having sex with her boyfriend or whatever. And
Yeah.
I was like, you do realize that there are some of us who are in our 50s and wish we had more sexual partners, right?
Exactly.
And she was like, what?
Exactly. I know. Isn't that so funny?
Yeah.
Um, I totally know what she's saying. I often say kind of in a just funny way, that I used to believe that fairy tale that one day my Prince Charming would come, and then so would I.
Yes.
It was
Amazing.
almost like I just would, that's what I believed. I Melissa, I was
Yeah.
just like, thought that my entire sexual being rested in the hands of my future husband, and that
Mm.
he was going to, you know, be the end
Unlock
all
the
be all, no,
key.
unlock the key. Yes.
Wow.
Yeah.
So interesting.
So to have this vaginal rejuvenation procedure, to feel how much it transformed me only because I let go of the shame. And then
Hmm.
to be able to talk to patients who actually were so concerned about feeling broken. There's so many other ways that, perimenopause, menopause can change your libido, but they physically felt broken because they were not having orgasms with vaginal penetrative sex
Hmm.
and felt that they should be.
Right.
They felt like their that, and they had been taught that. And I think a lot of
Hmm.
men have been taught that.
Right.
And so I started to research how do I talk to my patients about their sexual function, pre-procedure, post-procedure, and there was such a dearth of actual like questionnaires and ways to
Yeah.
really quantify this.
Right.
But anyway, as I was researching it, I came across Sophia Wallace's TED Talk. And Sophia Wallace is this wonderful artist. And she had these 6 foot tall gold statues of what she was calling the clitoris.
Mm.
And I was looking at that thinking, oh, it must just be her artistic representation of the clitoris. This is 2018, because I still didn't know.
Yeah. You thought it was
And
just the little
yeah,
nub at the
I thought
top.
it was just a little dot. That's what
Mhm.
I had been taught, I
Yeah,
thought.
that's what we were taught in medical school. We certainly did
Right.
not dissect out the bulbs of the clitoris.
Absolutely not. And so when I saw her talk and I realized, okay, so then I just kept digging and realized, oh my gosh, this artist knows more about female anatomy than I do. And then I really realized, no, I'm not alone. I actually brought home this little glitter statue.
Mm.
And
Yeah,
I
I
showed
love
it
it.
to my husband and I was like, and he's a physician.
Yeah.
So I said, and I think I was probably a little angry. I'm like, do you know what this is? It's a life-sized part of our bodies. And, he didn't know. And I'm like, it's our clitoris. It's the
Yeah.
clitoris. And then I thought, oh, wow, nobody knows this. Like, this is just not known to physicians in general. And then, looking at how, if we don't know this, then how is it impacting our health as women? And hearing stories about women being surgically harmed because with the advent of the digital age and the, I guess the plethora of videos and pictures and pornography that has come up, this
Hmm.
has caused women to want to go have labiaplasty procedures.
Right, right.
So they think they're supposed to look like Barbie,
Hmm.
which means they
Right.
think their labia majora or labia minora are too large and they
Right.
want to have it all surgically changed.
Tucked in.
That's
Yes.
right.
Yeah.
And when that happens, surgeons don't have no idea that there are dorsal clitoral nerves
Yeah.
that
Oh
are
God.
inside the clitoral hood. And so they're actually causing surgical harm. And then women are either having chronic pain afterwards or inability to have orgasms because
Mm.
their dorsal clitoral nerves are severed.
Shot.
And
Yeah.
and they don't know that the labia minora are part of our they have sensation, they have erectile tissue, they get engorged with arousal, and they're
Hmm.
important to our sexual functioning. So they're just removing them because they don't
Hmm.
know.
Hmm.
And even when women have other surgical procedures like lumbar spinal fusions, they can have permanent inability to have an orgasm afterwards because their clitoral nerves are impacted.
Wow.
And so I was gave this talk, and a woman came up to me after, and she said, "I had a lumbar spinal fusion 10 years ago, and now I think I couldn't orgasm after."
Mm.
And I went to my surgeon. I asked my surgeon what happened, and he didn't. He said it was unrelated. She said, "But now
Right.
I think it is related." And from her story, my literature search revealed that if you have a lumbar spinal fusion, there are a million ways you can map out how to preserve male sexual function
Mm.
and prevent retrograde ejaculation for men. A million. And there's so many studies, but
Right.
there's none about women and female sexual function and impacting the ability for women to have an orgasm after that. And that's just one procedure.
Right.
But
This is
there
my
are so many
shocked
others.
face.
Yeah. I mean, it's so sad. So, in so many ways, this talk has really, and it's made me want to show women, number one, we have to know our bodies. And we have to know the names of our genitals. We can't refer
Right.
to everything as vagina, which we
Hmm.
tend to do. And even I
Right.
did that. I
Yeah.
never
Oh
used to
yeah.
say my vulva. I mean, who says
Hmm.
that? We should say it.
I taught all of my patients. I'm
Oh,
so
you
proud.
did?
Mhm.
Yay.
Yeah, because they
Because
would call it their vagina or their
I
kitty cat
know,
or their
I know.
pocketbook or
Yes,
what. And I'm
yes,
like,
all of those cutesy
no.
names. Right. We're
Yes.
going to call it the vulva. Well, what do we teach? I mean, in general, I think it was my neighbor who said to me in her she has little boys and girls, and she said, I was so happy. I really use anatomical terms when I'm telling my kids what their body parts are. I say, boys have a penis, girls have a vagina. And
Mm,
I said, I know, but boys have a penis and girls have a clitoris.
mm,
That's the anatomical homologue.
yeah.
And that is nothing I've ever heard before.
Right.
Like, because the anatomical homologue is the penis and the clitoris, they come from the
Right.
same embryological tissue. They
Right.
actually serve the same function sexually.
Right.
Um, and
Although the penis has more functions than
it
the
does.
clitoris.
It needs to urinate and it does need to
Mm-hmm.
ejaculate, but we don't think of it that way.
Mm-mm.
I mean, we truly
No.
believe that our vagina encompasses all of our all of our female sexual organs, and
Mm-hmm.
really the vagina is our birth canal.
Yeah. It doesn't do much.
Doesn't do much. And there aren't very many nerves in there because if there were, we'd never be able to give birth. Um,
Right.
but it's interesting because I really did grow up believing that exact
Yeah.
fallacy. Like I just
Yeah.
never thought about it in the terms that
Right.
I now think of it. And it makes the lack of our knowledge so glaring
Mm-hmm.
that if you look at the what we learn in middle school, sex ed,
Mm-hmm.
and
Mm-hmm.
you just look at the penis diagram and the testicles, and what you see is the uterus, the ovaries, the fallopian tubes, the vaginal canal.
Mm-hmm.
And nowhere on that diagram is the clitoris. And so at that young age, when we're all really trying to learn about our bodies, the female sexual organ is completely omitted. And I have a new diagram that's very pretty and it has the clitoris on it.
Yeah.
And it's so shocking to look at it if you look at it because you realize how much better it would have been if
Mm-hmm.
we had learned it that way, as if
Mm-hmm.
it was no big deal to have a
Right.
clitoris.
Yeah, that we're supposed to, and
Yeah,
pleasure is supposed to be a part of life,
that's
and that
right.
we wouldn't have this part if we weren't supposed to
That's right. And we can't say the
experience
word
pleasure.
clitoris without the whole room being in shock.
Yeah.
In fact, my original talk, so my website is called theclitoris.com, which I
Yes.
love, love, love.
I love
But
it
then when
too.
I tried to get speeches, they didn't want to have that as the talk
Oh
title.
no.
Do you know what I mean? Even I forgot that it's taboo when I would,
Yeah.
so I had to change it, which is fine.
Yeah. Right.
But
Just change it so you can get in the room
that's
and then
right.
you can say whatever
That's
the hell
right.
you want.
Right.
Yeah.
Yeah. They wouldn't write it like on the hotel, like where they do all the
Yeah, the
digital.
boards.
Yeah. Nope. All of that stuff. Isn't that so funny?
Well, I'm thinking, I'm so glad you got censored. I know at the beginning, like I said,
Uh,
fuck censorship,
that's
but
exact. I agree. I
I mean,
agree.
it just like, thank goodness it led you down this. I'm going to call it a rabbit hole, but I mean,
It
thank God
was.
it led you down this vaginal tunnel and up through the
There you
vulva
go.
and the
That's
clitoris.
perfect. Yes,
You
exactly.
pop out of the vaginal canal, and there you are.
That's right. Yeah, no,
Oh
I'm
my
so glad
gosh.
too, because
Yeah.
I think that the more that women know about their bodies and they can use the right anatomical terms and they can
Mhm.
teach those terms to the next generation,
Right.
that's going to start, interrupting this shame, ignorance, and silence cycle. Because when we
Hmm.
don't know what we're talking about, we feel shame. When we feel shame, then we feel ignorant about what we're talking about. And it is just a shame, ignorance, silence
Yeah.
cycle. And if we continue to refer to everything as the vagina,
Mm-hmm.
then we are not giving ourselves the permission to be sexual beings.
Mm-hmm.
So the
Well,
clitoris is
and I
so
mean,
important.
I don't know. There's like the beauty of saying vagina even because even that, I
Even
mean, I
that is so
remember
censored.
when my mom
So
taught me that, my grandfather was so upset.
you're right. So even the word vagina is
Mm-hmm.
censored. And in fact, there's a list of the most censored words on Meta,
Mm-hmm.
and the vagina is the most censored word. And
Mm-hmm.
there's such a discrepancy between male sexual health and female sexual health ads that are censored in
Mhm.
on Meta, that there's
Mhm.
an organization called the Center for Intimacy Justice, and it gathered 60 of the biggest female health companies, and and now they have an organization that can then advocate to get the laws changed to help with censorship for female health. And these
Mhm.
are companies that might be, you know, sex toy companies, or they
Yeah.
could be urinary leakage, or uh, lactation specialists, or information about sexual consent, or period
Mhm.
information for
Mhm.
young girls menstruating. But
Mhm.
it's just anything that has to do with female sexual health is censored. So
Yeah.
vagina, uterus, ovaries, just any word really normal, lactation, breastfeeding,
Mhm.
practically every word you can imagine is censored for
Yeah.
female sexual health. And so it's certainly something that needs some advocacy.
I love it. And I love that you're out there doing this work in Columbus, like,
Yeah,
helping.
it has been received with such I think awe, and people are so shocked by how much they didn't know. And in
Mhm.
my office on one-on-one with my patients, I am constantly talking about this. And I have these lovely, like little vulva puppets, and they're
I
quite
love it.
nice because you really cannot discuss this without
Mhm.
having some sort of anatomical model. And
Right.
we don't have anatomical models that are available. I mean, I
Yeah.
literally had to buy them on Etsy. In fact, any sexual health, or, even Kelly Casperson, you will see they get all of these things in non-medical sites, because that is not where we can get models. You can get models where you can take out the uterus, you can take out the bladder, but there's
Mhm.
no model that you can then take out the clitoris.
Yeah.
It just doesn't
See,
exist.
bullshit.
I know. So one woman at a time, we're going to change
Yeah.
this narrative. And I hope that when they learn about their bodies and they realize how much physicians, even physicians don't know,
Mhm.
they're going to clearly advocate for their health in situations that could impact them. So
Yes. Oh,
I
yeah.
I I don't know if you felt this way, but I think a lot of people, but I grew up like revering doctors and
Oh,
thinking that I
yes.
couldn't question anything. And
Right.
I think they're fallible. There are things they don't know, and they're not
Yes, we are
teaching.
both here to tell you that we didn't learn
That's
this.
right. We didn't learn
There
it.
was no
And
class about this.
no. And in fact, in medical school, I remember during physical diagnosis lab, they said, during the genital exams. They said, don't touch the clitoris. It's way too sensitive. Women are going to be very, bothered by it. But of course, we
Mhm.
were taught exactly how to examine the penis and
Mhm.
pull back the foreskin, just normal stuff that you would do. So, Rachel Rubin, who's also a urologist, I don't
Yeah.
know if you, so
Yeah. Oh,
they
yeah.
did a study out in where she is. I don't know where they did the study, but they did a study in
Mhm.
2024 that showed that 25% of women actually struggle with clitoral adhesions. So
Mm.
that can cause pain
Right.
or sexual dysfunction for women.
Yeah.
But as physicians, if we're not even examining that, we're never going to detect it.
Right. Exactly.
And
Yeah.
we're taught
You
to
have
not
to
examine
see
it.
it to know. Yeah.
Yeah.
So interesting. You kind of talked about this, Nina, but I want everyone who's listening to hear you for sure say this about the myth of the vaginal orgasm.
Yes, I would love to talk about that,
Yeah,
because
please.
this is something that I think people are still unsure about. And even I was met with all of these different theories about orgasm, and how there is initially, when I started researching, I read there are clitoral orgasms and there are vaginal orgasms,
Mhm.
and you could have one or both or neither. But now I firmly, after studying the anatomy, I firmly believe all orgasms are clitoral.
Mhm.
And so if you look at how the clitoris is structured, it has the clitoris itself, the clitoral tip that we're all aware of, then it has the shaft, just like the penis, and then it has four legs that insert. Two insert into the pelvic floor. These are the internal parts of the clitoris, and then two that surround the vaginal canal. The two that insert into the pelvic floor contract your pelvic floor with orgasm, which is why you feel your pelvic floor contractions, just like men. I mean, they have the same thing.
Right.
And then the two that surround the vaginal canal are what you had referenced, clitoral bulbs, and they become very engorged with arousal, and they become very, they actually have a lot of erectile tissue in them. And when you're aroused as a woman, it can feel really good to have vaginal penetration.
Mhm.
But when you're not aroused, it typically doesn't feel that good. And so all sensation for women, it really centers around the clitoris and what we can call the clitoral complex or the full anatomy of the clitoris. So it's so kind of obvious to me now that the vaginal canal, it certainly feels a lot of sensation, especially in the outer one third of the vaginal canal that can feel penetration and can feel more of the direct expansion.
Mhm.
But there aren't a lot of nerves in the distal two thirds. Just why
Mhm.
you can wear a tampon without
Right.
being really uncomfortable. That's why you can
Without
have
even
genital
knowing that
birth.
it's there. Yeah.
Exactly. And so it makes sense to me that the area that we all call the G spot, which is located inside the vaginal canal. So if you're, putting your finger inside your vaginal canal about a few centimeters up, if you're trying to touch your belly button from the inside, that
Mhm.
area is called the G spot. And that is the confluence of where all the clitoral legs meet. And so that area has been dissected to see whether or not there's really histologically anything special about that area, and there
Mhm.
is not. So there
Mhm.
is no real G spot, but it is definitely where all the clitoral legs, come
Mhm.
together. And so there's a
Mhm.
lot of heightened sensation there. But I think the clitoris itself is really what's responsible for all of our orgasms. And this has also been shown in women that have either spinal cord injuries or if they have had female genital mutilation, like can they have orgasms? I know, and that is a really sad topic. Um, but the ability to have an orgasm is really very clitorally mediated,
Mhm.
I guess is my point.
So, what I'm hearing you say without saying it
Yeah.
is if you are having penis and vagina sex or penetrative sex
Yes.
and not having an orgasm, you
Yes.
need to involve your clitoris somehow.
That's right. That is exactly right. And typically, what has happened is that women go into their sexual experiences because this is what they learn as a young woman. They go in not expecting it to be great, at least the
Yeah,
first time.
right.
Go in with this really low expectation. The bar is pretty low. You just don't want it to hurt and you don't want to
Hmm.
get pregnant. I mean, the
Yeah.
two things that we generally are, when we go into these first sexual experiences, a lot of fear. And most of us, are not having an orgasm during that first sexual
Right.
experience. And what we really have to understand is we need to advocate for ourselves. So, first, you got to know your own body. You have to masturbate. You have to know what feels good. Then you have to
Right.
communicate that to your partner. What feels
Yes.
good?
Yes.
And so women go into sex without the expectation of having an orgasm, but they can change that whole dialogue, interaction, narrative with the expectation of going into sex and expecting to have an orgasm. Apparently, there's been a study that shows it increases your chances of having an orgasm by 2000% if all you do is go in with the expectation that you want to have an orgasm,
Wow.
right?
Yeah.
So
Again,
this
your
is
brain
right. And
being
so
part of the equation.
yeah, but we go in thinking that we're not going to have one, but men go in thinking they are going to have one.
If they
That's the
don't, it's
expectation
not
every single
successful.
time,
Yeah.
right? So there's
Hmm.
this huge orgasm gap that's occurred now. That
Hmm.
means that women are not having as many orgasms as men on a general basis. If you know that person really well and you're in a committed long-term relationship, and as a woman, if you're able to advocate for yourself and you feel comfortable and you can relax enough to actually allow yourself to have an orgasm, your chances about 65% of the time you'll have an orgasm, and a man will have one about 95% of the time in that best case scenario. And that's where we live right now. But if you're in a friends with benefits situation, you know them, but you're not in a long-term committed relationship, it's about 30 to 35% of the time you'll have an orgasm as a woman. That's really pretty bad. If it is a first time hookup, you don't know that person at all, the chance that you'll have an orgasm is less than 5% for a woman. So there's this huge orgasm gap, and it has to do with us
Yeah.
too. I think
Yeah.
it's
Yeah. Yeah.
mainly us. I
Hmm.
actually I think this is something women can change. So
Right.
men learn about sex through the media, movies, and pornography. I mean,
Right.
that is what's teaching them about sex, and that is made by men And
Unless their mother is Melissa Parsons.
right, unless they're lucky enough. But that's only a few kids in this world. Or their doctor, I suppose. You could have influenced a lot of kids. Um, yeah, so men don't know.
Yeah,
They think it's vaginal thrusting. They're taught that the harder
right.
they thrust, the more likely their partner is to have an orgasm.
Mm-hmm.
And that's what they learn. And unless we speak up
Mm-hmm.
and take it into our own hands, so to
Right, right,
speak,
right.
or really just vocalize what feels good and actually have to get into, like you said, the right headspace. Um,
Mm-hmm.
so there's this, lack of attention to women and their sexual pleasure that has been around forever. It actually, I wondered if we had only just mapped out the clitoris recently in medicine. I had read something on the internet that said, "Oh, we just mapped it out like 30 years ago." And
Mm.
I thought, "Oh, wow." And so
That's a
two of
long
my
time.
kids are in medical school. I know. So this weekend that so this is kind of like, this is kind of a little bit probably too much detail, but I'll tell you. So that weekend that I got censored, I got this, email and talked with them on a Friday. Well, my daughter was home from medical school with her two of her friends, and they were all graduating that year. One was
Oh,
going into
exciting.
OBGYN and one was going into ophtho. And so the three of them got a chance to hear me rant about being censored. And I got out my clitoris statue, and I fully expected that in 30 years since I had been in med school, that those three would know everything I was saying because they have social media. I just figured this was something that was, they knew that I didn't
Mm-hmm.
know because,
Mm-hmm.
no, they
Yeah,
didn't know any of
no.
it. And
Yeah.
I thought, oh, oh, wow. So then it led me to the rabbit hole. And I
Mm-hmm.
realized that the clitoris has been clearly mapped out since the 1600s. And
Wow.
we've seen it in medical texts. They're actually more clearly depicted in medical texts from the 1800s than they are in medical texts today. And what
Wow.
happened in 1948 is the editor of Gray's Anatomy, Charles Goss, it removed every single mention or diagram of the clitoris from Gray's Anatomy. Like what we're supposed to learn from.
Yeah, right.
Removed it completely. Yes, it made its way back, but that he was allowed to do that, that was okay, that he could just
Right.
remove a part of the body
Mm-hmm.
and say that this was the anatomical Bible for all medical students, and he was allowed to do that is shocking. So I feel like we're still recovering from that.
Yeah. Oh, yeah. Still recovering from so much. I mean, that's the year my mom was born, 1948. And I just think about all the women of her generation
I know.
who, had no information about this. And then they were also like double whammied with the Women's Health Initiative and didn't get any
Absolutely.
HRT.
Hormones.
And
Yes.
yeah, I mean, thankfully we're swinging back and
Thankfully, we're swinging back, but I will tell you that it is a little bit distressing for me, which is also why I feel like I need to tell, even more so than telling doctors, I feel like I need to tell women about this because women are going to be able to embrace this knowledge and hopefully protect themselves from medical harm, which I think is really important. They can undergo procedures that don't adequately discuss their possibility of having a change in their sexual function. And they just need to
right.
make sure their doctors, if they're having a surgical procedure, or even just a vulvar biopsy, are aware of where the
Hmm.
clitoral nerves are. Like,
Right.
I think it's a legitimate question.
Yeah. What
Um,
questions should they be asking, Nina?
so they really need to ask how that doctor is going to protect their sexual function.
Okay, that's it.
Yeah, I
Okay,
think that's a good
perfect.
one because that's not going to offend anyone. Like
Hmm.
they may not want to pull out like these diagrams of the clitoris.
Can I give
How
you a quick
yeah.
anatomy
Well,
lesson
yeah,
before
well,
you
yeah,
do my
exactly.
surgery,
What
please?
risks do I have to my sexual function during this procedure? And how are you going to protect my sexual function from harm? And
Right,
trust me when I tell you that if they ask those questions, they're going to understand whether their doctor has any clue or not have any clue.
right. And if they're like, oh, we don't have to worry about that, then it's time
Right.
to find a new surgeon.
That's right.
Okay. Okay,
That's
fair
right.
enough. Fair
Hmm.
enough. Fair enough.
Yeah.
Um, I know we don't have a ton of time,
Okay.
but you kind of glossed over how you got rid of your sexual shame.
Yes.
Do you want to speak about that at all? I mean, you
It
don't have to
was,
tell me personally,
yeah,
but you
no,
can, but
no,
however
no.
it
So
works.
what it was, it was, uh, how do I say this? It was by accident.
Okay.
And what it took, now that I know what I was doing, is actually just
Mm-hmm.
remaining present in my body. So
Mm-hmm.
instead of acting like it was a gift that I was giving to my husband,
Mm-hmm.
and when you have that attitude, you don't believe it's for you. And
Mm-hmm.
so if you change that and you think this is all about you, and
Mm-hmm.
you physically are present in your body in a way that I just hadn't been to that extent before,
Mm-hmm.
where the entire experience I felt was all about me, my pleasure, my sensations, my body. And so when I think if you're, I don't know how many other women feel this way, but to really be present and feel that this is like you're paying attention to your sensations and you're paying attention to what feels good and you're willing to vocalize it. Um, and then it just becomes a lot more fun. And then
Mm-hmm.
you realize that being sexual in your body is not shameful and that you're not going to be, um, put down for it or uh, considered promiscuous.
Right.
I think these were thoughts I had that were just so
Right.
deep-seated that to
Oh,
verbalize it,
yeah.
it sounds silly because, of course, it's my husband and he would never think that. But to actually go through it and to realize that by embracing your sexuality, by living in your body in the moment, every second when you're intimate with someone, it is a different experience because you
Mm-hmm.
can go through that experience and not be in your body.
Yeah, you can be
And
totally shut down. Yeah.
yes, yes. And
Yeah.
I won't want to say I was totally shut down. My husband wants to make sure that I say that we had a great sex life
My
before.
husband would want me to say that too, so I
Right,
will verbalize that.
right. I get
Before
it.
I got my clitoral stimulator, we had a great sex life. And after I got my
Exactly.
clitoral stimulator, we totally
That
closed the orgasm gap and
That's
like I'm
that's
totally winning.
exact. And you know that I didn't know that some women cannot orgasm without a vibrator. Like
Mm,
sometimes their clitoral nerves are just the type that really
yeah,
respond to vibration. And so
right,
that is a reason that some women may have said, I've never had an orgasm or have only
right,
been able to have an orgasm by themselves.
right. Yeah,
And
yeah.
so yeah, I think that it's amazing when you talk to women and you really many of my patients don't know where their clitoris is until I
Mm,
show them, or
right.
they have never masturbated, would never think of masturbating. And really, I need to encourage them to explore their body, even if it's just touching their arms and legs. And
Hmm.
sometimes I think having them see a specialist is, really great. And I definitely encourage
Yes.
that. But the shame
Yeah.
that they have, that they carry, is so deep-seated that being in their body during intimate relationships is just not part of what they've ever done. Um,
Right,
and I think, I haven't really talked about inclusion here because it is hard because I really am just talking about cisgendered women and
right.
men, heterosexual experiences, but of
Yeah,
course, all experiences are valid. And
right.
if if we could change the way we view that word virginity, because we
Hmm.
go in as women and young girls like losing our virginity as if it is
Right.
something that is taken from
We
us
give it
and
away. Yeah.
we give it away, and it's something that just the penis entering the vagina is supposed to somehow like magically change us. And
Mhm.
I think the idea of making our sexual debut and changing
Mhm.
that verbiage
Mhm.
from losing your virginity to making your sexual debut, it might be a kinder and gentler way. And to
Mhm.
define it, we could define it as the first time you're able to have an orgasm with a partner.
Mm.
That's when
So
you've made your
beautiful.
sexual debut. Because that basically shows you that you can have trust, intimacy, warmth,
Right.
connection with another human being. And
Right.
that's what you want to get out of,
Yeah.
intercourse.
Yeah. I love it. And I love it that you brought up the fact that we are totally being
Yes, yes, it's hard.
exclusive
Yes, I
and
want to make sure that
mm,
it's understood that sex
yeah.
can mean sex for
Love is
anyone.
love and
That's
sex is
right.
sex. And there isn't
Yes.
a gender gap in lesbian relationships.
Yeah,
So
there is no orgasm gap with lesbian
yeah.
relationships, which
Yeah.
I think is so great.
Yeah,
It
they're
just
winning.
yep, that's right.
So good. All right, sweet Nina. Is there anything that you wanted to talk about that I didn't ask about or that we
Gosh,
didn't
I'm
get
so
to?
glad that we got to cover so
Yeah,
much.
I know, me too.
Let me think about this. Let me actually look at my notes here. I
Yeah.
do have some images, and I don't know what
Yes,
can
please. I will
be.
put them in the show
Okay,
notes.
okay. Because
I won't do
just
anything. I will send them to Grace and she will put them in the show notes.
okay, I don't know how we can get some of this stuff. Oh, I know. I did want to say one other thing because I think it's
Yeah.
fascinating. And
Yeah,
this goes
please.
towards women being advocates for their own health. So there's this word hysteria,
Oh,
which has
mm-hmm.
come from the word hystra, which means uterus. And the word hysterical has been used to describe women. And it really implies that women are just these emotional creatures that are unable to have leadership qualities and can be, stable. And um, I guess I internalized that growing
Mm-hmm.
up, even though I
Mm-hmm.
was in medical school, becoming a doctor, all these things that you would think. But still, I kind of thought, well, men are better leaders.
Mm.
But yeah, I
Girl.
know. I know. Okay, that has been unlearned over many years. But um, the word hysterical is one of many words that has been used to describe women as being emotionally unstable and incapable of leading. And the data really doesn't support this at all.
Right.
Women-led countries do better than male-led countries. Women-led companies do better on so many different metrics. But women physicians actually perform better and have lower mortality for their patients than male physicians,
Yes.
all different types of specialties. And
Yes.
one of the best studies that I think really highlights this was a landmark study. It came out in JAMA, and it really came out just maybe 5 years ago.
Okay.
It was by the physician group in Ontario. Christopher Wallace is a urological oncologist in Ontario, Canada, and then their medical system, they can mine charts really easily. So they looked at surgical outcomes of 1.3 million patients, and they looked at 3,000 surgeons, and they age matched them. It was a very well designed study. And they just looked at what happened if you had surgery from a female physician, a female surgeon versus a male surgeon. And they had all these other criteria. But one of the most shocking findings of the studies was that if you were a woman and you had surgery from a male surgeon, your chance of dying over 30 days and 1 year was 32% higher than if you had just gone to a female surgeon, which is like utterly shocking to me.
Yeah.
And if you were a male patient and went to a male surgeon, your chance of dying was 12% greater than if you had just gone to a female surgeon. And that, I think it's important for women to know that.
Mm.
It doesn't mean that you have to all choose female doctors.
Right.
It means that you need to communicate with your doctor and believe that you're being heard, and then listen to yourself, your gut, your
Mm-hmm.
instinct,
Intuition.
intuition. Listen to yourself if you don't feel like you're being heard,
Mm-hmm.
because there's data to support that, not just with surgery. With surgery, it's like the worst, honestly. It's
Right.
like
Right.
the
Right.
biggest delta between health outcomes. But even in Medicare patient population, they
Right.
looked at hospitalized patients, and if it was a female hospitalist taking care of that patient, they performed better. That means that about 32,000 patients would have lived in that year that they were doing this study had they been taken care of simply by a female physician. And there's another study that showed that if you walk into a Florida ER, I just think these are fascinating because it really, I think, validates sometimes women have intuition that they don't follow. And
Right.
so if you walk into a Florida ER, they did 20 years of history and 580,000 patients. And they said if you were having symptoms of a heart attack, did it matter if you saw a female ER doctor or a male ER doctor if you lived? And the answer was yes. If you saw a female ER doctor, you had a better chance of living, full stop. It was worse if you were a female minority. The delta is always greater if you're any
Right.
kind of non-dominant group. But if you were a white
Mm-hmm.
male, it wasn't that important. You could see a male or a female and you were going to be okay.
Shocker.
But
They live.
anything else,
Those motherfuckers live through everything.
right. And so that's why I also want to give this talk because I really, really want patients, I want women to know specifically, number one, you can embrace your own yourself as being a sexual being, and it can make you more powerful as a woman.
Yeah.
Number two, we need to start naming our body parts correctly because we got to teach the next generation. And then number three, you have to protect yourself from harm. medically
Hmm.
because we
Yeah.
don't really know. Not all of us know, and I don't honestly say most of us don't know this
Hmm.
information. Not only just about clitoral nerves, but also let's just look at the meta-analyses that have been done for the performance of female physicians, which is just
Hmm.
a phenomenal statistic that
Yeah.
actually two of my kids graduated from med school in the last few years. Both of them were taught that female
Wow.
physicians have lower mortality for their patients. They
That's
weren't taught about
amazing.
the clitoris, but they were taught about that.
Baby steps, baby
Right.
steps.
I
We'll
was
take
like,
it.
oh, yeah. Yeah. So that's another thing I did want to talk about.
Yeah, I love it. Thank you so much for coming
Oh,
on
you're
and
so
for being
welcome.
your beautiful self and just
Well, thank
sharing so
you so
much.
much. And I loved your podcast on sexual health and
Yeah, pleasure.
sexual
I'm a
pleasure.
big pleasure seeker.
I know. So I know this is right up your alley. So
Yeah,
yes, I
one
really
for
do
me
appreciate it. You're
and
getting
for
the word out.
everyone. Yep, that's the
Yes.
plan. All right, Nina, if people want to find you, how do they find you?
Yes.
How do they work with you? How do they come be your patient? Tell us everything.
Yeah, I think the easiest way is probably just to Google ninadeep.com because
Okay.
that goes right to my website. There's a link there to my other website, which is it's called theclitoris.com. So if they want to have me speak, I am always willing to speak to large groups and small. And then if they have any other questions about, what we do in Columbus, the ninadeep.com is the best place.
Yeah, amazing. Thank you so much. I know you're going to help so many of my listeners today, and I appreciate it so much.
Well, tk you so much.
All right. See you all here next week. I can't promise it'll be as exciting as this one, but we'll try. All right. Let me stop recording here.